The main difference is that cosmetic surgeries are typically an elective procedure, whereas reconstruction is typically for a cancerous process or other medical diagnosis. It could be something such as skin cancer or breast cancers and things of that nature. Recovery from cosmetic surgery will depend on the procedure we're discussing. If we're talking about face and neck lifts, generally that's a pretty painless procedure, honestly. Recovery time for that's about 7 to 10 days. If we're discussing something more like liposuction, recovery time can be anywhere from, from the initial surgery can be about 7 to 10 days, but then your recovery process continues into 3, 6, and even 8 to 10 months. As far as wearing your compression garments and being compliant with those things, it provides an opportunity to have the most successful outcomes both for the patient and myself. And this is just to getting you to look the way you want. Benefits from any procedure is variable, of course, but I like to say that anytime you undergo something like facelift or liposuction, that you're always a step ahead. So say you undergo a face and neck lift procedure, typically you're always 7 to 10 years ahead of where you would have been. More men are having cosmetic surgery, actually. There are patients that I see for gynecomastia reduction, also face and neck lift, brow lifts, eyelid surgery, and injectables. Botox is typically repeated every 2 to 3 months, and Juvederm is anywhere from 8 to 12 months. Depends on what your overall goals are, I'd say, and then on examination we kind of determine what sort of a candidate you are for which type of procedure in breast augmentation, and from there also it depends on the amount of tissue that you already have. Face and neck lift primarily focuses on the lower face and neck areas, the jowling, the chin, submental area, and the neck. And if you do nothing else at all, you'll always look about 7 to 10 years younger. When you talk about mini facelift, I would rather call it like an injectable. This is something similar if you've heard of Botox or Juvederm. It's more like Juvederm in that it's a filler. Voluma is a product of Allergan, and it's injected into the malar prominences, and this is just for a slight lift in that area, gives you more pronounced cheekbone. Also can soften the lines around the eyes and some of the jowling down in this area. What's the recovery time? Recovery time for that is simply a day. The effects are immediate, and this actually lasts up to 2 years. Each patient on their own individual basis is evaluated by myself, as well as preoperative testing through their primary care doctor and the anesthesiologist that would be present the day of surgery. All three of us evaluate the patient and determine what's best for them. But they're definitely screened preoperatively to make sure that their surgery is safe. The patient is evaluated, seen for examination during their initial preoperative consult. We discuss things like lifestyle, fitness level, and willingness to commit to their postoperative instructions. Whether it's elective, cosmetic procedure, or reconstructive surgery, it's important on the part of the patient they take some responsibility for their postoperative care. And I might say that the patient's willingness to commit to postoperative care, the instructions and things like that, is just as important as the procedure itself. Depending on the nature of the procedure, whether this is elective or more of a functional problem or reconstructive surgery, there are options available. Certainly most or some elective procedures are out of pocket. We do have financing options available Also, some insurances will cover various conditions and various procedures to treat those. We do have a financial service called Prosper Financial, which the patient can come in and see if they're a candidate for. Patients, honestly, I consult patients all the time on their nutrition, other than their diet, including, simple things just like drinking water, skin health, hydration, not only drinking water, but moisturizing the skin, things like that for improved suppleness. All of these things, including increasing your daily activities, is possible for you. Just improve your overall outcomes as far as the appearance of your scars, fine lines in your face, whether we're talking about injectables or even post-operative recovery. I always recommend patients, it's easy to forget. I think it's important that patients wear sunscreen, simple preventative measures like that. Also, there are other sort of skincare procedures. I would recommend patient seeing some of our professionals over at the Med Spa, also with Kansas Medical Clinic here, and they, in tandem with my surgical capability or injectables and things like that, can just optimize overall results.